Hi, I'm Dr. Lydia Sosenko, educator and practitioner of oral appliance therapy and dental sleep medicine for the treatment of snoring and apnea. Today's question I'm going to be answering is, why do I need a medical evaluation if I am just snoring? So I want to talk a little bit about snoring. Snoring is caused usually by a narrowed airway passage. For a variety of reasons, the airway gets narrowed and creating a bottleneck effect. That bottleneck effect causes air pressure issues above and below the bottleneck. And when the air is trying to get through when you're sleeping and breathing, it causes a vibration in that tissue in the throat passage, unknowingly known as snoring. Now, snoring, it could be just snoring, but it could be something more important if it's related to such a narrowing that oxygen starts dipping in your blood. So if snoring is turned into what we call apnea events, and apnea, the airway passage becomes so narrow that there are oxygen dips. You actually either stop or pause breathing for 10-second increments. And what happens is the oxygen level dips in your blood and causes havoc. That oxygen dipping events can cause you to arouse from sleep, to awaken from sleep unknowingly, but it also can cause issues on your heart, an increased chance of high blood pressure, stroke, heart attack, even automobile accidents. So there's a lot of havoc that can be caused by repeated oxygen dipping events that could be occurring if you have apnea. So if you are snoring, and I hear people in public arenas often kind of making small talk of it, but if you have common complaints from spouses, from family members that don't want to share a room with you when you're traveling, and if you are that regularly snoring, it is a great idea to get medical evaluated. Number one, it will rule out other medical issues other than apnea. So it could, they definitely could rule out soft tissue masses. It could be allergies. It could be other things that's causing the snoring. So having a medical evaluation will help define what is happening and give you a diagnosis. Secondly, if you do have apnea, it's important to know, do you have mild, moderate, or severe apnea? It is common for someone to have severe apnea and actually not have a lot of other symptoms. They might be feeling good, they might be feeling rested, but they're just snoring. And on the flip side, I've seen patients that have a lot of symptoms, morning headaches possibly, they are tired during the daytime, poor sleep, and they have mild apnea. So a sleep test can help confirm, are you mild, moderate, or severe apnea if you have apnea. It could absolutely save your life. Apnea is a life-shortening condition, so I urge you, if you are chronically snoring, to get medical evaluation of some sort. So there's more videos coming up on the questions that you need to ask if you have a sleep test, along with other treatment options for snoring or if you have apnea. So stay tuned to some other videos. I encourage you to like this video, share it. It might save somebody's life. And if you have any questions, feel free to write them down in the comments or reach me through one of my channels. Thank you so much. Till next time.